So exactly who is the most susceptible to the coronavirus? Well, we all want to know that for sure. Is it striking more in dense urban areas than in more rural areas? And what underlying conditions are correlated with testing positive? Well, the Locke Foundation's healthcare policy analyst, Jordan Roberts, has taken a look at a study that drills down into insurance claims related to COVID-19. He joins us now to reveal what all of this has found. Jordan, welcome back to the program.
Thanks for having me.
Give us a little bit more detail, if you would, about the data that we're going to discuss.
Right. So this is Fair Health, a nonprofit research organization that they collect private insurance claims. And so they have a repository of about 30 billion healthcare claims. So this is a massive sample all across the nation. So very representative sample. And they compiled some of those claims and, broke it down by key variables such as age, gender, location, things like that to, hopefully give a more complete picture of, like you said, what are the characteristics of patients who test positive for COVID-19. So that's what this data is looking at, positive tests and those individuals, what characteristics they had.
This could be really helpful to each of us to at least have in our minds a little bit of a more determination of the level of risk that we each face based on all this. Let's talk first about age. Tell us what the claims show.
Well, this is, all across the nation, a nationally representative sample. What they found is that the majority of cases are in the 51 to 60-year-old age range. And so this is, typically consistent with what we knew from the beginning. Those older and typically a little bit worse health than younger individuals were the most susceptible. But, the most striking thing to me is that 60% of the total cases around COVID-positive cases around the country were those above age 51. So that leaves only about 40% of those positive cases in individuals below the age of 51.
That's really curious because if we connect this up to what's happening in North Carolina, we know the Governor Roy Cooper has now issued yet another statewide one-size-fits-all mandate. This happens to relate to alcohol consumption, cutting off at 11 p.m. And so you would tend to think that if you're talking about people who are congregating essentially in restaurants that turn into bars late at night, that would be a younger crowd than this stat shows.
That's right. And, what we can hopefully glean from this data is that everyone can, assess their own risk, make the right determination for themselves. What activities should I participate in and what I shouldn't? And, that's what we hope to achieve by putting out this types of data. And we appreciate Fair Health for compiling these insurance claims for us.
Let's talk a little bit about the gender situation, because I know that here in North Carolina, and again, the claims data we're talking about is nationwide, but here in North Carolina, if you look at the Department of Health and Human Services data dashboard, and you look just at the deaths from COVID-19 in North Carolina, it skews male. I believe it's 54% male, 46% female. So as we look at the insurance claims across the country, what do we find about gender and who is testing positive?
So the Fair Health data shows us that males, a little higher, a little more susceptible to COVID-19, but it's not by much. And what we've seen with a lot of these other studies that kind of confirm this is that it's about a 50% chance males and females, can skew a couple points in either direction. But right now it seems there's about a equal chance of getting it between genders.
And what about health status? Because certainly we have found, again, here in North Carolina and in other states too, there's a big problem in the congregate living settings.
Sure.
Older people, nursing homes, assisted living, etc., where people tend not to just be older, but to have multiple health conditions. Are we seeing that in the insurance data?
Right. So that's exactly what we're seeing. So what Fair Health did was they compiled a list of the 10 most common comorbidities that an individual had out of the pool of people that tested positive. And what they found was about 13%, I believe, of positive individuals suffered from kidney disease. And this was the most prevalent of these pre-existing conditions. And, other conditions such as diabetes, hypertension, atrial fibrillation, these comorbidities that are typically common and typically more common among older folks, these are the types of patients that we're seeing most commonly in the hospital testing positive for COVID-19. So again, this is consistent with what we know from the early days of the virus moving into couple months in here, but those that have a pre-existing condition or something that would predispose them to an attack by the virus, those are the ones that are more likely to get this disease.
And you've actually included in your piece, which is available at johnlocke.org. I would encourage everyone to take a look at this. The headline on this research brief is Characteristics of COVID-19 Patients. And this list of the top 10 is really interesting. Again, this is the percent of hospitalized COVID patients. As you mentioned, the number one, chronic kidney disease and kidney failure, then type 2 diabetes, hypertension, atrial fibrillation and flutter, which I believe is a heart condition, heart failure, and as you go down the list, things like sleep disorders, chronic obstructive pulmonary disease, asthma. My husband happens to have asthma, and that's why we consider him high risk.
Right.
So this is a really good profile, I think, for people to be able to assess what's going on in their own family.
That's exactly right. What we're seeing now is, there's so much data available, concerning the disease coming from all different kind of sources. But, the best data available, I think, is stuff like this that, paints the full picture, gives people an idea of what type of risk is most associated with a positive test for COVID. And that allows, individuals, like you said, to assess their own risk, to see, what type of activities they should and shouldn't be doing. And this is what we should be getting from our public leaders. That's what the North Carolina Senate tried to include in the COVID relief package bill to get DHHS to release some of this data about, who is hospitalized in North Carolina, what types of comorbidities did they have. Fortunately, that didn't make it into the final COVID relief package, but DHHS has, slowly been updating their website, putting out more data. But, it's these characteristics of the individuals who have the worst bout with the disease that, is really telling for the rest of the public, how big is my risk? And this is the kind of data that tells us that.
Jordan, in your piece, you also take a look at the costs. These are, after all, insurance claims
Right.
that are being analyzed here. What did we find out about testing costs, treatment costs, et cetera?
It varies, and this is typical. It'll vary by age and by the severity of the treatment that the individual needs, but it also just varies on what type of insurance you have, because insurance claims and costs are kind of all dependent on negotiations between your specific insurer and that hospital or that provider. So it can vary, but typically older people, more expensive, higher intensity treatment, and the cost can vary whether you're insured or uninsured. But one interesting note, in the Provider Relief Fund set up by the CARES Act, they set up a funding stream for uninsured individuals, and providers can bill that portal to pay for uninsured claims. And this was one of the big questions. People who are uninsured, lost their insurance, how can they pay for it? But what a recent report revealed is that a senior administration official said that portal is not being used as much, so it's interesting now, but there is money available for uninsured, and we hope that nobody has to pay large out-of-pocket sums for this, because the money has been provided. It just needs to be allocated.